Good morning, everyone. I'm Specialist Gilmore. This morning we're going to be conducting an individual training session on task number 081-831-1005. That is going to be performing first aid to prevent or control shock. This is unclassified information, and the risk assessment for this is low. Please be aware of your AO, be aware of any chairs, tables, seating, anything that can be in your way that could be a trip hazard because you are going to be moving around the casualty. Be aware of your water intake. We are inside, but you still need to be drinking water. You need to stay hydrated, all of those. Also, please be aware we are going to be moving around casualties. We're going to be stepping over, running around. Make sure you do not drop them, step on them, anything that could cause personal injury or harm to that individual soldier. So we're going to dive right into it. The objectives of today's training mission, we're going to identify the signs and symptoms of shock so you know exactly what to look for. We're also going to learn how to properly treat and maintain a casualty who is exhibiting these signs of shock. And then we're going to learn how to be efficient during the treatment. We're going to learn how we can remain confident and calm while we're doing this and not freak out and act like we've never done it before. The conditions of this exercise, so you're going to see a casualty who is breathing. There's no uncontrolled bleeding. The casualty has one or more symptoms of shock. The only required materials for this you're going to need either a field jacket, a blanket, or a poncho. Today, for the sake of training, we're going to be using the full blankets. They have the shiny inside with the green outside to reflect the body heat. And the standards that you will need to accomplish in order to pass this evaluation. So we're going to attempt to prevent a casualty from going into shock by correctly positioning the casualty, loosening binding clothing, calming and reassuring the casualty, and providing shade from direct sunlight during the hot weather, or covering in cooler weather to make sure that we keep that body heat inside and keeping them warm so they don't get cold, because chances are if they're in shock, they have lost a lot of blood and they're going to need every bit of warmth that they can. So the signs and symptoms of shock, you're going to look for pale, cool, clammy, wet skin, very white. They're going to be cold to the touch but sweating profusely. The next one is going to be restlessness, nervousness. They're almost going to be anxious for something or anticipating something, won't be able to sit still. They're going to want to move around. They're going to be freaking out. Severe thirst. They're going to be extremely thirsty. They're going to come back even though they're sweating and they might have just drank a whole canteen or Camelback of water and refilled it. They're going to be extremely, extremely thirsty. They're going to have a dry mouth. They're going to have everything pointing towards them wanting to drink excessive amounts of water. Severe hemorrhaging, severe bleeding. You're going to look for any limbs that are gone, any bullet holes, any place that they could be bleeding profusely. Check the head, check the eyes, check the ears, make sure there's nothing coming out of those because it could be an internal injury. They're going to be very confused. They're not going to know where they're at, what's going on, what happened, why they're feeling this way. They're not going to know any of that. It'll be almost like a concussion, shell shock if you want to call it. They are going to be very severely confused. They will have shallow, rapid breathing. They're not going to be taking those breaths that we're accustomed to, the deep, the very rhythmic, very few every so often. This one's going to be well over 25 breaths a minute. They're going to be very shallow, and they're going to be just one after the other. Cyanotic skin. So any bluing of the skin. It could be blotchy, could be large patches, could be just fingertips, nose, or ears. But look for that blue color in places blue shouldn't be. That's one of the big signs. And finally, nausea and or vomiting. So they could feel like they're going to vomit, they could vomit, they could feel uneasy, stomach ache, queasy, however you want to put it, whatever words you want to put it into. Now you know what to look for. Now we're going to learn how to treat. So first thing you have to do before you can begin to treat your casualty for shock, you have to get them off of the X, get them behind cover, and stop any bleeding. Blood loss is the #1 cause of death on the battlefield. Blood loss, shock due to blood loss is probably #2 because everybody gets freaked out, everybody doesn't know what's going on. They were just fine, but they have lost a lot of blood. So, first things first, you get to them, you stop whatever bleeding you see, you get them behind cover, then you can reassess and make sure all the bleeding is controlled, and then you start your interventions. Second, you're going to position them in the recovery position. So the recovery position is going to be on their back with their stomach facing forward, flat, and you want to raise their feet 8 to 10 inches above their body level. This promotes the blood flow that would be pulling in the feet to run back to the main organs that you need for your body to continue living and functioning. So that's why we do this. Do not raise the feet of a casualty if there is any type of thought or suspicion of a leg fracture. If that leg is broken, you think it's broken, it could be broken, do not pick their legs up. Leave them laying flat, and if anything, put them on a slight incline. If the casualty comes to you and is sitting upright, is sitting down, and they are breathing fine, they're communicating, they're alert and oriented, do not try to lay them down. If it is being controlled with them sitting up, do not try to lay them down because that's only going to freak them out more, and it could cause more injury to you or to them. Once you get them in the position that's most comfortable for them and they're relaxing, you're finally talking to them, they're not freaking out anymore, the confusion's starting to die away, you're going to loosen any tight or restrictive clothing. So that could be anything from the Kevlar to your body armor to sleeves to boots to belts. Anything that's buttoned or zipped up, release all of that. Let them breathe, let them feel free. Don't make them feel like something is grabbing onto them, latched onto them, and keeping them. After this, you're going to splint. So anything you suspect is broken, this is where you take care of it. Legs, you're going to splint to make sure that the constant moving or thrashing is not going to throw bone splinters or anything like that into arteries or veins or nerves or even into the muscle. It's just going to be uncomfortable. It's going to cause more pain and more injury. Arms, anything done with the arms, you're going to want to splint those to immobilize them. When you immobilize them, you're going to promote bleeding to stop. And you're also going to promote for immobility and to increase the rate of healing of whatever that may be. Once you splint, once you get everything taken care of with them, they're comfortable, they're there, then you're going to cover the casualty. This is where the blanket, the jacket, the poncho, the whoopee, anything you have on you that can be used to conserve body heat is what you're going to use. And finally, the biggest aspect of this, stay confident, stay calm, cool, collected, everything you possibly can that is going to make sure you reassure them. Because if you're freaking out while trying to provide aid, they're going to freak out and they're going to thrash and flail and scream and want to move and get out of anything. And that could only cause more injury to you or the casualty. So now I'm going to talk you through a quick demonstration of how all of this should be done. So, you're walking with your team, you're on a patrol mission. As you're walking, there's an explosion, everybody's blinded, blown back. You get back together for accountability, you gather yourself, and you have somebody down on the X. So at this point, you are going to provide cover for them. You're going to send out a CLS, a medic, whoever is with you that can take care of them. And they're going to do treatments on the X. So you get out there, they're going to look, oh, bleeding. They're going to control that bleeding with the tourniquet and get them to cover. Once you're in cover, then you make sure the bleeding is controlled. That's the very first thing you need to do. Always check anything after a movement. Make sure your bleeding is in control, under control. Once the bleeding's under control, you're going to lay them on their back flat. You're going to take their Kevlar. You're going to take whatever you have that you can put up under their feet. You're going to have them on their back, arms by their side, and you're going to have their feet rested like that with their head on the ground. Again, if you're looking and they have a broken leg, do not prop their legs up. For this instance, we're going to say that nothing is wrong with their leg, but their arm is missing. So once you get their legs up, then you begin to unblouse, release, relax, anything that you possibly can. So you're going to undo the sleeves, roll them under once. Do that on both arms. It gives them that empty space right here. Okay, you're going to undo their boots, untie them, take them off, lay them beside them, lay them with them. You're going to, whether they're wearing boot blouses or they have them tied, you're going to undo those, let the pants go, roll them under one time, create that loose airflow. You're going to unbutton the blouse or unzip, whichever version of the uniform they're wearing. You're actually going to take the blouse off and then recover them with it so that it's not constricting any arm movement. At this point, you're going to check. You're going to make sure tourniquet intervention is working. You're going to wrap what is left of the arm, and you're going to splint it to them. So you're going to want to tie it down so they can't move it. It's immobile and it's sitting there. Tourniquet's effective. You're good to go there. Now is when you cover them. So you're going to take your blanket, your jacket, anything that you have that you're going to cover them up with to conserve their body heat. If it's a little warmer, you don't have to worry about covering their back. You just put it over the top of them. Make sure all that stays bouncing as it expels. It's staying right there with them. If it's colder, you're going to want to lay the blanket under their back, wrap them over, and you are going to want to tape it shut. That way it doesn't unroll later on as you're going. And you're going through more interventions and more steps. And as you're doing this, you're going to continually reassure them. You're going to continually maintain your composure, maintain that posture, maintain that sense of duty that you have, and not freak out. When you freak out is when they freak out. And that's going to absolutely push them the opposite direction. And they're going to go down a hill that you didn't need them to go down because you had them maintained. Now they're freaking out. Your interventions may not work anymore. You're going to have to recheck them. You're going to have to reposition them. And you're going to have to do all of these steps again. Remain confident. Remain calm. Reassure them. Reassure them. Reassure them that you know and you have them and they're going to be okay. So at this time, all of you are going to conduct an assessment on how to prevent and control shock and go through the interventions. I will be walking around and I will be observing as we go. And we'll come back later and we'll talk about the results. So overall, pretty decent. Y'all did good. Y'all went through every step. The biggest thing that I did see, however, the common error that was being made was whenever it came time to splint the legs or the arms or anything like that, you were going ahead and covering them up. So if you cover them before you splint, then you could have an injury that's causing to this shock that you didn't have time to evaluate or you didn't check to evaluate. So for the two of you that did not meet the standards of this exercise, we will have a retest in 2 days. So you have 2 days to look over whatever you need, relook over your notes, check what is good and what you were good on. And from then on, you're going to come back 2 days later. We'll reassess you and we'll see where you have gone from today to then. So that concludes the training session. At this time, we're going to conduct an AAR. So the purpose of today was to learn how to treat, control shock on the battlefield. We learned the signs and symptoms of shock, and we put all of that into action. Once we realized shock was going on, we performed our treatments and interventions on a casualty. So, from that, are there any sustains? Any improves? Anything we should implement next time? All right, again, the overall risk assessment for this activity was low. I see nobody was injured, nobody was hurt. We cleared our AO, there were no chairs, tables. Please police your area. Get all of our training equipment together, put it all in one spot so we can find it later. Make sure everything is clean, get all your trash, anything like that that you could have ripped off whenever you were completing this exercise. Everything is clear, everything is clean. And on that note, y'all are dismissed.